Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today, we are doing a comprehensive deep dive into Bupropion. Commonly known by brand names such as Wellbutrin SR and Wellbutrin XL, this video is for educational purposes only and does not replace professional medical advice. What is Bupropion? It's an antidepressant, but it's not an SSRI. It is an NDRI, standing for norepinephrine dopamine reuptake inhibitor. It targets norepinephrine and dopamine rather than serotonin. Pharmacologically, we see inhibition of the transport proteins for both norepinephrine and dopamine. This increases their availability in the synaptic cleft, which is the key distinction from our typical SSRI treatments. In plain language, Bupropion helps with mood, energy, and focus. It's often used for smoking cessation too. Because it avoids serotonin, it tends to have less sexual side effect burden than SSR is. I like to say Bupropion is the antidepressant that walks in with coffee and a clipboard and says, "Okay, let's get moving." But we must consider anxiety, seizure risk, and blood pressure first. Commonly, it is used for major depressive disorder. It is particularly helpful for patients who present with melancholic features or significant fatigue and low motivation. For seasonal affective disorder, or SAD, timing is everything. Treatment often starts in the fall before symptoms emerge, helping to prevent the significant seasonal dip in mood. It is also a primary tool for smoking cessation. Under the brand name Zeban, it works by reducing cravings and the symptoms of nicotine withdrawal, making it a powerful ally in recovery. Off-label, it might be used for ADHD symptoms, SSRI-induced sexual dysfunction, or low energy. However, it's rarely the first choice for patients with severe panic or insomnia because it is so activating. Let's talk about the brain. Norepinephrine handles alertness and focus. Dopamine handles motivation and drive. Bupropion increases the availability of both, helping with concentration and mood. It is not instant motivation in a bottle. It won't clean the garage for you, but it may give a patient enough energy to actually start the task. Motivation follows action, and this tool helps the action. The timeline matters for PMHNP boards. Week 1 to 2 usually sees energy changes. Week 2 to 4 is when early mood improvement starts. Fuller benefits appear between weeks 4 and 8. If response isn't adequate after 8 weeks, that's when we reassess the dose. Remember, patient education on this delay is critical for adherence. Don't stop too early. Dosing depends on the formulation. For Bupropion XL, the common starting dose is 150 milligrams once daily in the morning. We take it in the morning because of its activating nature. After about a week, if tolerated, it's usually increased to 300 milligrams once daily. This is where most patients remain for therapeutic benefit. The maximum daily dose for XL is 450 milligrams. Do not exceed this. Seizure risk increases significantly beyond recommended doses. The dose ceiling is a hard safety limit. For Bupropion SR, we start at 150 milligrams daily, increasing to twice daily. These doses must be separated by several hours to manage the release profile and safety. Practical tips: never crush, chew, or split extended release tablets. It ruins the release mechanism. And don't double up missed doses. Again, think about the seizure threshold. Taking it at night is a mistake. You'll be reorganizing your kitchen cabinets at 2 a.m., wondering why sleep is being so disrespectful. Stick to the morning routine. Common side effects include dry mouth, insomnia, headache, and nausea. Most of these are transient, but monitor them closely during the titration phase. Also watch for constipation, tremor, sweating, and increased blood pressure. Monitoring vitals at follow-ups is a board exam pearl you need to remember. Always check BP. Board exam pearl. Bupropion is often the go-to when SSRIs cause sexual side effects. Since it doesn't boost serotonin, that specific burden is much lower. It's a key clinical distinction. Safety warnings are critical. It is contraindicated in patients with a history of seizures or eating disorders like bulimia or anorexia. This is due to the electrolyte shifts and seizure threshold. Also avoid it during abrupt discontinuation of alcohol, benzodiazepines, or barbiturates. Screening for these risk factors isn't optional. It's foundational for safe practice. Always screen for bipolar disorder to avoid inducing mania, and monitor suicidal thoughts in younger patients. Never combine bupropion with MAOIs. Safety first always. If we skip the eating disorder or seizure history, we aren't being thorough providers. We're just guessing in a white coat. Use your clinical judgment and do the history work. Time for some board prep. Question: which neurotransmitters does bupropion primarily target? The answer is norepinephrine and dopamine. This is the hallmark of an NDRI. Question 2. Why is an eating disorder history a contraindication? The answer: it significantly increases seizure risk due to potential electrolyte imbalances. This is a common board question. Consider a patient who feels jittery or too wired on day 3. This activation is common. We educate them on morning dosing and monitoring for any worsening anxiety or insomnia. What should families understand? It's not sedating. Monitor for agitation, irritability, or impulsivity. If the patient becomes very activated, they need to contact their provider immediately. Let's recap the board pearls. 1. It's an NDRI. 2. It's not an SSRI. 3. It lowers the seizure threshold. 4. Always check for a history of eating disorders. 5. Monitor blood pressure. 6. Morning dosing is best. 7. It spares sexual function. 8. Understand the differences between XL and SR formulations. In summary, bupropion is a powerful NDRI tool for depression, seasonal affective disorder, and smoking cessation. Used carefully, it changes lives. Check out rotationmatchnetwork.com for more. My name is Dr. Ben Osevwe. Remember, anxiety may be loud, but with the right treatment and support, it does not have to be in charge. Subscribe to our channel for more. Thank you for being part of our mentorship family. Educate, monitor, support, follow up. I'll see you in the next educational video. Success starts with preparation. For additional support, you can text 832-991-6516. Join our mentorship family today. We are here to help you succeed in your PMHNP journey. Stay focused, keep studying, and I'll see you next time. Goodbye for now.